So hi, how are you guys doing today? Today's Monday, and I want to talk to you about dental implants. What is a dental implant? You know what? A dental implant, I want to show you what a dental implant is. This in my hand is a dental implant. It's a small titanium screw that is placed surgically in the bone with the purpose of replacing, let's say the patient, the person is missing 2 teeth, or he's missing 1. By placing dental implants, you're able to avoid using a removable partial denture. The partial denture is the one that has the clasp and they hold, it stays up through the retention of the clasp. That's one of the purposes to use dental implants. Sometimes the patient has no teeth and they have a denture. They have a denture that stays up through suction. So they're constantly thinking of, they're afraid that this denture might dislodge when they speak, when they eat, because the suction might break. So by placing dental implants where you don't have teeth, and you place 2 dental implants, for instance, we could place attachments where the denture will have attachment, and when the patient places the denture, it snaps and they feel secure. They feel that the denture is not going to fall out of their mouth when they speak, when they yawn, when they eat. They feel a lot more comfortable. We place dental implants to replace, for instance, you have 2 dental implants here. We have a crown. We make another crown. Now the space is filled with teeth. So the dental implant takes the place like if it was the root of the tooth. By placing these dental implants, that jawbone stops shrinking, stops reabsorbing. So it's a great way to stabilize that bone. I love to place dental implants because I know I'm going to stabilize the bone and the patient will stop having that reabsorption of the mouth, of that jawbone. We also nowadays are doing a lot of these cases where we're placing 5 to 6 implants and we're doing a fixed detachable with 5 or 6 screws. We're able to hold that denture, that fixed detachable, in the mouth. And the only way to remove this is you come to the office. Every so often we come and we remove those little holes that I showed you, are filled up with a bonding that will mask the color of the tooth. You can't even see it. But we remove it with the idea to get back to the screw. And we're able to remove this every 6 months, once a year, to clean it. But we do teach the patient how to maintain this clean. It's another way of restoring your mouth. So as you see, implants have evolved into something that everybody that comes to this office, the majority of the people, either they want cosmetic, they want veneers, they want crown and bridge, they want implants. So it's another tool we have to be able to help the patient to restore their missing teeth, to restore, to help them in retaining removable appliances. So you could go to your dentist. You could ask them to see, they do an evaluation. They'll take good x-rays. They'll do a CT scan, 3-dimension x-ray, to see if you have enough bone to place these dental implants. That's something that you could ask your dentist if it's something that interests you. So I hope you found this educational. something that would help you or somebody you know. And you can always call our office if you have any doubt, any questions, and we'll be more than happy to see you. Have an awesome remaining of the day, which is it's 5:30 right now, so I hope you guys are going home like I am going home now. Take care.